In this demonstration, I'll be covering the basics of the clinical desktop, which is a central hub for the EHR in FreeChiro. The first page you'll be brought to when you access the clinical desktop is known as the Appointment tab. From here, you can see a list of the appointments that you have for today as default, or if you would like, you could also use the arrow keys to go forward and back a day. If you wanted to jump a larger amount of time, you could also use the calendar icon, which allows you to choose a specific date that you want to look at. There are also various options of filters lists. For example, if there are multiple providers at your location, you can select which provider you want to look at, and you can also use the menu to the right of the provider drop-down menu to select what kind of schedule status you want. For example, you could look at only the checked out appointments, or you could look at only the checked in appointments. By default, the two statuses that you will see is the confirmed status and the checked in status. Besides simply clicking on the text to access one of these patients' records, you can also change the exam room from here. For example, if this patient got moved from the waiting room to exam room 2, I could simply click on waiting room and it will bring up the window that you see here. Now, if I click on this, I'll get a selection of the exam rooms in my practice, and I can select exam room 2 and press save. And this will reflect on the appointment tab. Now, if my patient is not actually coming in with a scheduled appointment, there's another way I can pull him up, which is from the Patient tab. Going to the Patient tab, what you'll see is that there is a patient search field at the top, and then a table for patients below. So for example, if I was searching up a patient with the last name of Test, what this will do is return me a list of all the patients that have Test in their last name, including Testing, Test 5, and Test. And like the Appointment tab, if I click on one of these, it will bring up the medical records for that particular patient. In addition to the ability to open up a patient's medical records, you can also use this as a direct place to open up an incomplete chart that you may have already started in the past. By default, your charts will be saved as pending, so you will typically be able to find them on the pending charts list to the right, and you can organize this either by patient name or by date. In addition to the pending charts list, there's also the Ready for Exam tab and the For Review tab, both of which are ways that you can save incomplete charts for future reference. And I'll go into more detail about the various methods of saving these charts in a later video on the charting tool itself. Beyond accessing patients' medical records, there is also the Reminder tab, which is the place where you can view the reminders that you have set up for various patients. So for example, if you want to set up a reminder to give a patient a phone call for a follow-up visit or some other sort of task that needs to be handled, you can use the Reminder tool to help you out. Finally, there is also the Messaging tab, which will take you to the inter-office messaging system. You can use this to pass along patient information securely along with a message to other users of your EMR system. So to review, from the clinical desktop, you can open up a patient's medical records either from the Appointment tab or the Patient tab, or you can continue working on an already started chart. And this can be done from the pending charts list, the Ready for Exam tab, and the For Review tab. Besides that, there are also two other tabs that may be of use, those being the Reminder tab and the Messaging tab.